We do about a series of 15 to 25 treatments of the laser to the brain. We've worked on people, for our criteria is people living with symptoms of post-traumatic stress and people living with symptoms of traumatic brain injury. So
TBI.
we did a lot of outreach to veterans. So we've had some veterans that came through, and after a couple treatments, we would do some check-ins with videos. We check in every time, but I have some videos of people saying, "Oh, I don't know. This is the first week that I've noticed I haven't had a nightmare, and I've had them every night for 3 years." And it gives me
Wow.
goosebumps.
Yeah.
Like I said,
And
it is
that's
just
after
a
like three
phenomenal
treatments?
treatment. Yeah. So after like 4 or 5, I think is kind of the marker of
They're
that
kind of
one.
the
And I think
typical.
the dream center is the parietal part of the brain. A common and all our patients don't see each other. They don't like know each other, but there's some commonalities in the interviews that we do. And 2 of the females both had been sexually assaulted, I think in childhood and then possibly later in life. And they both said that at some time in the treatment, I don't know if it was around 8 or 10 treatments, that they said they had a nightmare. It came back, and it was bad, but it was of a scene that kept reoccurring in their head, and they couldn't like close the loop.
Yeah.
So they said once I had that, it just kind of like something switched in me.
Wow.
So the other things that the laser helps with is lowering anxiety or getting rid of it, depression, sleeplessness, brain fog's a big one. The nightmare is the one that's most fascinating to me, is to someone who's just had nightmares all the time, that you just no longer have them. Just, yeah, it's unbelievable.